Hi, everyone. Thanks for joining today's phPIN webinar. We're glad to be back after a bit of a break over the summer. My name is Ariane Reeves, and I'm a public health nurse, public health advisor with the Division of Performance Improvement and Field Services and CDC's Center for State, Tribal, Local, and Territorial Support, or we call it CSTOS. CSTOS supports both phPIN and the Public Health Improvement Training, or FIT. And I work with NMPHI on both of these. I'm happy to welcome today's presenter, Dr. Stacey Plichta from the City University, New York Graduate School of Public Health and Health Policy. Thank you, Stacey, for presenting today. Now it's time for my colleague at NMPHI, Nicole Waller, to go over today's agenda, some logistics, and tell you a bit more about Stacey. Nicole, you're up.
Thank you, Ariane. We have a few housekeeping items and introductions before we get started today. If you have any technical problems, please type out your question for us in the question feature. This session is being recorded, and the recording and slides will be made available later to people who are not able to participate. And please type in your questions or comments into the question box. We will read your questions out loud throughout the presentation and at the end. We welcome your questions and comments. You may ask your question anonymously as well. If you have any remaining questions at the end, please follow up with us through email. All right, let's quickly review our agenda for today. We will start off with our presenter introductions, our webinar objectives, the presentation, and our discussion session with the audience. And then we also have some phPIN announcements. Okay, our presenter today is Dr. Stacey Plichta, who's a full professor of health policy and management at the City University of New York Graduate School of Public Health and Health Policy. She came into public health over 25 years ago as an advocate for battered women and children. Her work now focuses on the occupational health and well-being of frontline and first responders to victims of violence and how work sites can help these workers. She designs and conducts annual wellness workshops for the New York State Adult Abuse Training Institute and other sites upon request. Dr. Plichta has most recently completed a study of occupational wellness and health in family justice center workers in New York City. Her doctoral degree is from the Johns Hopkins University School of Hygiene and Public Health. She completed a postdoctoral fellowship at Yale University. She also has certifications in public health and applied integrative medicine from the University of Arizona. When not working, you can find her in her garden raising fresh vegetables and teenagers. We are really excited to have her on our phPIN webinar today, and you may recognize her name as she facilitated our closing session at the Public Health Improvement Training this past June in New Orleans. Welcome back, Stacey. Now I will hand it off to Stacey, who will take a moment to share her screen with us. Stacey?
Okay, I am here. Thank you so much for that warm welcome. I think I have this, is this screen showing? Share, sorry. Do we have the screen showing?
Yep, your screen is showing.
Oh, fantastic. Well, first, thank you for the warm welcome. I am delighted to be here and to talk a little bit about workplace wellness for public health workers, because I think as folks who work in the helping professions often forget to help themselves. And all right, so I wanted to go over the agenda for a bit. I wanted to start with a mindfulness moment. It's a simple breathing exercise that can be done anywhere that is relaxing. I'll talk some about stress and the public health workforce. I'll talk about stressors and the physiology of stress. We'll talk about fight, flight, freeze versus rest and digest. talk some about how we can use the principles of integrative health and self-care to improve workplace wellness. And I'll touch upon the idea that organizations can make a organizational wellness plan, an organization wellness vision, as an organization, as opposed to just individuals doing wellness activities. So for the first thing I'd like to do, and usually I'm in front of people doing this, so it might be a bit odd on the phone. This is called the 4-7-8 breath. And the idea is that it stimulates the vagus nerve, it stimulates the relaxation response. As much as anything else, if somebody's upset or caught in the moment or tense, focusing on breathing in general has been found to be relaxing, and this particular technique brings you back to the present moment. So the way the 4-7-8 breath works is you place the tip of your tongue just behind your upper front teeth. You breathe in through your nose for 4 counts. And the important thing about these, it has to be your 4 counts. So a Navy SEAL is clearly going to do this for a lot longer than somebody with asthma. So it should be comfortable. You shouldn't be uncomfortable while you're doing this. So breathe in for 4, hold for 7, and then keeping your tip of your tongue behind your teeth, breathe out through your mouth, making a whooshing sound for 8 counts. So I'd like to ask everyone to do this with me, and you'll hear me breathe for a minute, and I will count for folks. So we breathe in for 4, hold for 7, and breathe out for 8. And typically, you would repeat that 2 or 3 times, you know, in a set of 2 or 3 at a time. But so I guess the next question I'd like to poll the audience and ask, what are some of the stressors in your workplace? And here you would use the question and answer function to reply to the poll. Okay, so far everybody has at least some stress. All right, we have 1 person with no stressors, 2 people. All right. And I wanted to talk about the stressors at the beginning, and then we'll talk, and you have to type those into the Q&A box because there was no way to do this through the poll. Okay, so why don't we end the polling? Oh, I see, okay, somebody. And clearly, so the great majority of people have stressors at work. And now let's find out what kinds of stressors. Okay, so I'm seeing, and I'm sure you all can see, there's a lot of things with deadlines and competing priorities, interruptions, too many meetings, interactions with coworkers, funding cuts, political landscape, time pressure, and employees not doing their best work. A lot about employees, workload and trauma, workload, yeah. So I'm seeing a lot of stressors here, some around interpersonal interactions, some around just the pressures of time. Secondary trauma is a very real issue that occurs. Even if you're not on the front line in public health, if you're working with folks on the front line and you hear their stories, it can be very distressing. I'm going to go ahead and people can keep adding for a little bit, but I wanted to go ahead and talk about stressors in the workplace. So things that can happen in the workplace, I think most of these fall into the categories that you all had brought up, are emotional abuse, that people can be rude to each other, people can be demeaning, time pressure, deadlines, not having enough time, not having enough resources, responsibility. If you're in charge of a project, you want it to go right. For people who are in frontline work, there are physical hazards of being out in the field. For people who are not necessarily on frontline work, if you work with folks who are on the front line, you may experience what's called vicarious trauma, which is when somebody, in short, in somebody else's distressing experience stays with you. So it wasn't a traumatic event that happened to you, but you heard about it and you may not be able to stop thinking about it. So you'll think about it while you're at home, while you're having dinner, while you're in the shower, to the point where it becomes damaging to your emotional health. And finally, I think an occupational hazard for people who do quality control is engaging other people in QI work, is engaging other people in participating in the interventions and participating in the activities and responding to the emails. So the next poll question is, how much does stress affect work performance at your agency? And that poll should be up in a minute. Okay, and as the results are coming in, the one that's, I mean, all of these, it looks like the result that's staying the highest, workers not being fully engaged, essentially present, and high rate of job turnover. So employers have a vested interest. Keep voting. I'll refer to these as we talk for a bit. Employers have a vested interest in reducing worker stress because stress is related. This is, people leave jobs, and if jobs are stressful, they'll go. There's also something called presentism, which I'll talk about. Also, absenteeism, and worker physical and mental health can suffer from stress. All right, so I'm going to leave the poll can stay up for maybe another minute, and I'm going to continue on. Okay, so health and occupational stress. So people who are stressed at work, particularly people in the helping professions, are at high risk for compassion fatigue, for burnout, for vicarious trauma, for depression and anxiety, but also for poor physical health. So stress is strongly associated with metabolic disorders such as diabetes and obesity, with cardiovascular disorders, with autoimmune disease, with digestive disorders. As as you can see. So, they're also at high risk, as the poll just showed, for suboptimal job performance. So workers who are stressed are absent more, and they're absent oftentimes for health-related reasons. They're absent because they just can't stand the thought of going to work. There's also presentism. Presentism is when people show up for work, but they're not really there. They're disengaged. So they might be at their desk, but they're not doing their best. They're not pitching in. They're not enthusiastic about being part of the organization. Stress can serve as a distancing factor. It's also, workers who are highly stressed are more likely to leave. And the thing to understand about stress is that it's physical, that we embody stress. So if one of the few take-home messages that folks take from this webinar, I'd like you to take, is that stress is a physical process that happens in the body. It's not just in your mind. It's not just something that you should be able to blow off or shrug off or ignore. It's literally your brain sending signals to your body and flooding your body with hormones. It's a physical process. How does stress affect you personally? If we can put the poll up for this, please. Right, because stress has been found to be, strongly associated with numerous health problems. And again, that's because stress is a physical process. So it's not in your head, it's in your brain. Yeah. So there are both physical and mental health effects of stress. Brain fog is common. That difficulty in concentrating, depression and anxiety and irritability are frequently common. People also get physiological problems related to stress: headaches, pain, digestive troubles, skin troubles, reproductive troubles, obesity. Pretty much every body system is affected by stress. So why don't we end the polling and we'll take a look so people can see the results. So you can see from the poll that your experiences match what the literature tells us, that stress has a physical effect on the body and on the mind. Okay. So the stress response begins in the brain. So when confronted with a stressor, our brain sounds an alarm with stress hormones, and our body responds to stress hormones. So who has heard of fight, flight, or freeze? Got a poll up for this. Give folks a minute to vote. All right, let's share the poll. Okay, so about 2/3 of folks have heard of fight, flight, or freeze. Fight, flight, or freeze. Oh, all right, so this is who's heard of rest or digest. So that's okay. Rest and digest is, we'll talk about that in a little bit. It is actually the other half of your brain. So fight, flight, or freeze, most people are familiar with. That's what happens when we're confronted with a stressor. Our brain gets ready to fight, to run, or sometimes to freeze in place. So the physical response to stress, and I wanted to spend just a little bit of time in the brain to really, help folks understand that stress is in our bodies. We embody stress. So when the stress hormones, when adrenaline, cortisol, norepinephrine, and a number of order hormones, the brain encounters a stressor, the sympathetic nervous system turns on, and the brain and body are flooded with these hormones. The physical response, our pupils dilate, our salivation decreases, our heartbeat gets faster, our airways relax, so we breathe, our heart's faster, we breathe deeper. Digestion gets inhibited. That is why when people are really stressed, their stomach hurts and they don't feel like eating, because the body takes blood from the digestive system and sends it to the extremities. It also, and relaxes urinary bladder. So sometimes when people are stressed, they may feel a need to urinate, to go, or to go more often. Now, not all stress is bad. There are a number of reasons that we'd want a stress response. If I'm walking down the street, we want a stress response as a response to danger. If I'm walking across the street and a bus comes, I want my sympathetic nervous system to kick in. I want to be instantly alert, better able to fight and to jump back. If you're going on a job interview, you want a little stress. You want to seem alive and alert and engaged, in the whole process. The problem is when you're stressed, if your stress is too low, if there's nothing that's stimulating you or making you interested and engaged, that's a problem. If it's too high, there's physical health problems. So stress is bad. When it becomes bad is when it's chronic, when there's no escaping it, when the workplace is always stressful, when the work is always stressful, and there's no way around it. When the brain is always sounding the alarm, that puts us in chronic fight, flight, or freeze mode. It's the chronic embodiment of the stressors, and it's physically wearing. It's very hard to be on alert and ready to go all the time. So allostatic load refers to when you have multiple stressors on different parts of the body due to the stress response all of the time. So the problem is when the body is not turning off the stress response when it's no longer needed. If there's an emergency, if there's something urgent, if we're giving a presentation, we need the stress response. But when the emergency or the event is over, we want that stress response to go away. The body may also become so immune to stress that it doesn't turn on a chronic response to begin with. There's an especially high risk of these things happening in high risk and high risk low control jobs. So just a short graphic to show how brain influences, how stress influences the body. And you can see things around the brain, things around cardiovascular, really every system is affected by chronic stress. Now, how can workers manage stress? Um, the relaxation response shuts off the alarm in our brain. Can we put up the results of the poll, please? So almost everyone has heard of the relaxation response, and that's controlled by the almost everybody has heard of fight, flight, and freeze. But a lot of people haven't heard of rest and digest. We can stop sharing results. Rest and digest is when your body is in relaxation mode, and that's your parasympathetic nervous system taking control. And the parasympathetic nervous system, again, I wanted to stress that these are physical processes. It relaxes the body. We embody relaxation the same way we embody stress. We release endorphins, oxytocin, dopamine, and serotonin, among others. There's a physical response to the calming stimuli, and our brain turns off the alarm. Our pupils narrow, our heart rate slows, our salivary glands stimulate, digestion works, our, you know, our breathing slows down, and we are in a relaxed state. Now, the good news is that we can only be in one or the other. Either the sympathetic nervous system is activated or the parasympathetic system is activated. We can't be both at once. So if we can do things to get our bodies into the relaxation mode, then we won't be in the stress mode and we can give our bodies a break. So the question is, how do we get to balance? The relaxation response is an active process. So as much as I like laying on the couch, binge watching Netflix, that doesn't kick off the relaxation response. Just like the stress response, we have to actually take action to elicit the relaxation response. And there are many things we can do. There are many things around mindfulness, around exercise, around taking pleasure in life, around building relationships. The self-care model is a really good model to use to elicit the relaxation response. And this is how self-care helps. Workplaces can move towards actively facilitating self-care for their workers and become wellness organizations. So I'll take a minute and talk about self-care and integrative health. I come at my model of self-care derives from an integrative health framework. So an integrative health framework is a healing approach that takes into account the whole person. The idea is that people aren't just our bodies. It's mind, body, spirit balance, and that wellness occurs when people partner with their healthcare providers. There's a strong focus on self-care and integrative health because, as we know in public health, most of the things we can do to keep ourselves healthy are things that happen outside the medical office. They happen outside the doctor's office. They happen with nutrition, with socialization, with relaxation, with exercise. Workplaces can also partner with workers to create wellness-centered workplaces. So in the integrative approach to self-care, there's the idea that self-care exists. You can think of self-care in these different realms. I'll talk about them in a minute. So environment, sleep, movement, nutrition, relationships, resiliency, and spirituality. And almost all of these are things that the workplace can help to engender and encourage on the workplace. So I'll talk a little bit more about what self-care is here. The reality is the one thing that workplaces probably can't do is sleep. So unless we have nap time at a workplace, there's not much a workplace can do at the site to promote sleep. But all of these other parts of self-care, workplaces can actively engage people and do things on site. For example, movement. Part of self-care is being active, is walking, is physical, is exercising, doing physical things for pleasure, gardening, being, there are workplaces that have started doing, exercise classes on site or walk at lunchtime, or even for workers who are mostly sedentary, because, sitting is, I think most folks in public health know now, is the new smoking. Workplaces can encourage people to get up from their desks, even if it's just for a little while. or to stand for a phone call, to stand at meetings. Nutrition is a big one where workplaces can take a stand. A lot of times the food provided at workplaces is yummy. You know, people bring in donuts, they bring in cupcakes, they bring in cake. It's harder to find healthy food at the workplace. You know, workplaces can encourage people to eat whole, non-processed, nutritious foods by making sure that they're readily available at workplace events and making sure they're readily available to workers. So instead of a box of donuts at the break room table, have a fruit basket. You know, there are larger things and smaller things that workplaces can do. Relationships are a big part of self-care. Human beings exist in relationship and we exist in community. And as folks had put up at the beginning, a lot of stressors happen from coworkers that don't get along, that are rude or that aren't pulling their weight or who are dismissive. There are things that workplaces can do through holding workshops, through setting values, um, to encourage and to work with workers so that respectful communication, it becomes part of the workplace ethic. Um, Even spirituality. So people usually think of spirituality as religion, and I'm not at all suggesting that workplaces should engage in or promote any religion, although they should, of course, respect all religions. But public health, we have public health values, we have public health ethics, we have a public health framework about ourselves and about the world that's based on a social justice framework. Workplaces and those values are our spirituality at the workplace. And workplaces can work to promote those values, to make sure the vision and the mission statement are in concert with public health values, and then to really use that mission and vision statement. Another area that can be, you know, workplaces can promote is the environment, managing the physical settings. Um, in self-care, you know, in the self-care framework, a good environment is one that's not cluttered, is one that has some connection to nature, whether it's plants or a window view, um, or you know, like a small rock garden, an environment that smells good, that's clean, to the, you know, to the best extent possible, and that's something else that workplaces can do. And finally, workplaces can promote resiliency in their workers. There are a lot of stress protective activities, particularly mindfulness activities, and some of them are fairly well known now. So, you know, folks are really familiar um, with, you know, with using yoga, with using meditation. Meditation doesn't have to be silent. Not everyone can do that. It doesn't have to take an hour. There are short guided meditations that work really well. There are, you know, short yoga sessions that can be helpful. And these are all different things that workplaces can seek to promote. So let's do a poll and say, what are some of the things that your workplace does to promote wellness? Yeah, and so we're waiting for the poll, for the answers to come up in the questions and answers. It's true that, you know, some workplaces simply don't do anything. Um, Other workplaces try, and the efforts don't sustain. And I can talk about why that happens. So a workplace will start with really good intentions, and they'll do a Friday noon yoga, and there'll be really poor attendance, and then they'll stop, and now they'll wonder what happened because they tried. You know, other workplaces have successfully been able to implement wellness and successfully able to implement wellness activities into the workplace culture. All right, let's give it a few more seconds and then I will go ahead and read the responses. Okay, so why don't we end the polling? And I think the responses are confidential, which means that we can see them as the presenters, but you all won't. So I will read the general categories. Okay. So if we can end the polling and put up the Q&A block, that would be great. Okay, so only a few people voted on this, which tells me that most workplaces probably aren't doing a whole lot because people like to share good news. And I don't know that I can see the questions and answers yet. Nicole, do you need to read
Sure.
those?
I can read some of these questions. We did receive quite a few, which is really great to see. So we're seeing some yoga at lunch, walking challenges, mindfulness activities, some promoting healthy snacks. I do see a lot of yoga,
Hmm.
which is great to see these days. Um, Posting signs for take the stairs, a wellness recovery room. Would love to hear
Nice.
more about what that is.
Yeah.
A group walk during paid hours. Um, let's see, stand every 60 minutes, healthy vending machines,
Nice.
wellness teams, cooking demonstrations, an on-site gym. That's pretty lucky.
Yes.
Um, Lunch and learn sessions to address activity and nutrition, financial wellness support, weight loss challenge, standing desks. I know
The
standing
standing
desks
dish is
are
great.
expensive and very valuable, so that's wonderful.
Yeah, but they're right, but they're not necessarily. Some of these are great. They can be implemented really almost anywhere, and others you would need a really good budget for.
Mm-hmm.
Yeah.
Offering outside activities such as bowling, movies, charity opportunities, and then somebody has a worksite wellness committee that hosts healthy potlucks, wellness
Nice.
challenges, lunch and learns. There's a wellness webpage, walking meetings, a breastfeeding policy, a funny boss, which can go a
Hmm.
long way.
Yes, it
Absolutely.
can.
Getting to know you newsletters. Yeah, so there's some really great responses here.
Yeah, there's
Thank you
some
for sending all
fantastic.
of that.
Yeah, thank you. Yeah, I don't know if there's a way we could type up the responses generically so they don't have identifiers and maybe share them with folks when we share the webinar later.
Sure, we can do that.
Okay. All right. So I'm going to take off. Oops, stop sharing results. All right. So I think there we go. The places that succeed at wellness are the places that have teams who are doing this, that engage the organization. And it sounds like some of the groups out there are doing this. And if you're just starting, or even if you're thinking, even if you're starting in the process for a little while, um, what can really help is a workplace wellness strategic plan. So, step one is always assess where your organization is right now. What activities do you do? What activities are people going to? What is the level of stress? Take measures of, what is the level of turnover? What is the level of stress? What is the level of absenteeism? And what is the health status, physical and mental, of the workforce look like? And what is the organization doing right now for wellness? And is it working? And how sustainable has it been? And then take those results and really develop a workplace wellness strategic plan with specific goals, and engaging coworkers to help set the objectives of the plan, so that the plan really belongs to the whole agency, so that it's not top down or just from one small group. Um, and then making the goals of the strategic plan SMART. And this is a QI group, so I don't really have to explain that. But the next thing I think that's important is, unless you have a lot of resources and a lot of buy-in from the senior staff, and this is a major priority, it's really best to start with one goal. Think of it as a PDSA project, that if you start with too many things, especially if you're coming as an organization from not doing a lot of on-site wellness, starting with too many things at once is not a recipe for success. It's kind of like the person who hasn't exercised in a year and then one day decides their goal is to get up every morning at 5 in the morning and run 6 miles. It's a great goal, but it probably won't happen. A better goal would be to get up at 7 in the morning and walk for 20 minutes, and then build on that. And then after implementing the one, the intervention for the one goal, to evaluate it and see how well the intervention met the goal. And I think that is how workplace wellness at the workplace can start to really happen. Um, all right, so let me switch. So let me switch tracks for a little bit, and then I think we can take questions at the end. So I just wanted to talk a little bit about what mindfulness is and how it can be really valuable at the workplace. So mindfulness is one of those words that has become, kind of cliche. So people think, oh yes, mindfulness is it. It's actually a really valuable skill to have. And it simply means to be fully aware with active, open attention to the present. And that's really hard to do. I am sure I have been to orbit. I am sure that some of you, while you're listening to this, are doing something else on your computer or writing a note to someone or having your lunch. It's really, really hard for us to only do one thing at a time. And mindfulness, but we function better when we only do one thing at a time. There have been some really good studies that show multitasking doesn't work because our brain is pretty much a very simple computer. It's an on-off. The whole brain is an on-off switch. So it's not that we're doing several things at once. It's that we're doing a little bit of a lot of things all in a row. And the studies have shown that we don't actually do as high a quality work when we do that. So mindfulness is the skill of being attentive to the surroundings, the actions, our bodily sensations, which we don't usually think about at work, and our feelings. One of the values of mindfulness is you learn to not be overly reactive. And this can be an especially useful skill in a workplace with coworkers who might be disgruntled or unhappy or just not nice to be around. And so in mindfulness, rather than reacting immediately when someone says or does something nasty, the first step is really to take a step back and think, what am I feeling right now? What are my thoughts? To almost step outside yourself and observe, and then to reserve judgment and simply take note of what's going on in the interaction or the situation. And then after, to choose a reaction. And there's actually fairly good evidence that mindfulness activities can help people to better manage stressors and reduces the effect of stress on health, because the stressors are going to be there. It's very hard to get them out of the job. So there were two short mindfulness exercises I think we have time for. I think we have time for, I'll do one and I'll go through them. One of them is very useful if you find yourself in a situation where you're becoming very reactive. Maybe you're having difficulty communicating with someone, or someone isn't willing to help you implement something that needs to be implemented, or there are a million things, or you have a teenager that's talking back to you. So part of what you can do is to simply notice right where you are right now, to stop. And that's what mindfulness is. It's like this pause in reacting. And you say to yourself, what are three things I can hear? And really focus. And I'd like to ask folks to do this with me now. So what are three things that you can hear? I'm in New York City. I hear a jackhammer out my window. I hear the static on the phone. And I hear the clink of my jewelry on the desk. And then ask yourself, what are three things I can see? Yeah. And really focus on them. I can see the picture of my husband on my computer. I can see the little fan I have. And I can see a crumpled Post-it note. And then what are three things I can feel? And that's a little tougher. It's like I can feel my desktop. I can feel the cloth of my pants. And I can feel my coffee cup. But just stopping for that second helps to reset us back into the present. The other exercise is when you're feeling very physically tense. This is also really good if you're having a hard time sleeping. It's called progressive muscle relaxation. And this one I'll leave for you all to do at home because I know we wanted to leave time here to talk at the end. But with progressive muscle relaxation, you start with your fist. You tense and tighten them as hard as you can for 10 seconds. And you don't think about anything else while you're doing it. You just really focus on what does it feel like to make a really hard fist. And then you relax them completely. Then you tense your arms as tightly as you can for 10 seconds, really focusing on your arms. And then relax them completely. Then stretch your legs out. Curl up your toes and tighten them as hard as you can, curled up for 10 seconds. Then relax them completely. And then do it the other way. It's not on here, where you curl your toes for 10 seconds. Do the same thing with your calves. Do the same thing with your thighs, with your rear end, shoulder, neck, back, and stomach. And at the end of it, do a 4-7-8 breath and relax at the end. And a lot of times, if you hold your stress in a part of your body, like your neck or your back, or your jaw, the progressive muscle relaxation can help with that. It can help relax those muscles. And that's also something that you can share with folks at a lunchtime session. And it's fairly easy to do. You can do it at your desk. Okay. There's some further reading here for folks who might be interested. And I wanted to really end with, sometimes self-care is not enough. It's like preventive care. So if I'm doing everything I can to prevent a heart attack, and I eat healthy, and I go for an annual checkup, and I exercise, but if I'm actually having a heart attack, that's not going to help. So there are times when you need to reach for outside help. If you feel suicidal, if you feel overwhelmed or you can't cope, if you feel bad about yourself all the time, if you find yourself self-harming, dieting or binging, turning to drugs or alcohol or tobacco, if you feel anxious all the time or sad all the time, it's not normal to feel anxious and sad and depressed all the time. We all feel that way sometimes, but if it's all the time, if you feel helpless and hopeless, it's really important to get professional help. A great resource for getting help is Psychology Today has a national database. And if you or someone you know needs immediate help, there's the National Suicide Prevention Lifeline. And really, that is what I have for the webinar for today, and I'd be happy to take some questions.
Thank you so much, Stacey. I'm going to just pop up our switch screens just for a moment.
Okay.
So now this is your opportunity to send us questions. We'll be able to read them out loud confidentially, and Stacey will be able to answer them for you. So I just wanted to address quickly that we will share this presentation and the slides for folks who would like to refer to it again. And while you're sending in your questions, I would like to just address some of the responses that we've gotten throughout the polling questions so far. So one that really stuck out to me was somebody sent that their organization was addressing people calling in sick when they may not be really sick, but they might have needed a mental health day. So I wanted to ask Stacey about that and see what your thoughts were about those types of sick days in regards to what you've been talking with us about today.
Well, I think that we have to start really viewing mental health on the same level as physical health. So if someone called in because they felt physically poorly because their stomach hurt or they had a virus, we would be understanding, and if someone would just the same as folks need physical breaks for physical ailments, people can feel overwhelmed and may need a break for a minor mental illness. We tend to think of mental illness as only being severe and chronic, but people can have bad mental health days and should be able to take the break the same way. However, just like you would seek further help if you kept having a lot of bad physical health days, folks should also be encouraged to seek help if they're having a lot of bad mental health days.
All right, thank you. I know I had been wondering about that since that question popped up. Um, so I see we haven't had many questions in yet, so please do send them our way. Uh, I also wanted to address another response. A couple of these responses are geared towards, being understaffed or having a high workload. And are there any tips that you can give these folks to, bring this up with leadership or communicate this issue with people who make decisions in the workplace and who are leading the projects?
Absolutely. And I think the way I would recommend to go about it is an evidence-based way. So to bring this up to higher ups would, people will require like, some data. Uh, but if there's historical data on workload, and if you can show that workload is increased, that before this is what a caseload looked like for public health, or this is what a workday looked like, and now it's been increased to this much. And if you can also show that at the same time there's increased absenteeism, or you're not making your metrics for your own quality assurance the way that you expect to, or that people are leaving the job, or that you have vacancies that you can't fill, all of those things give evidence that may help the higher ups to see that it's worth the investment if they can do it in more, in more staff. The other alternative is when organizations have less resources, is the higher ups may want to reprioritize. It may not be possible to do everything the organization would like to do with the level of staffing and funding that it has. But I think to convince management, higher up management of that, and to convince policy leaders of that, you really have to come with evidence, both qualitative and quantitative. I mean, I think people's stories are important. The stories of how the work is affecting them, as well as the yeah, sorry, like I think we're doing a fire drill or something. People's responses are important. As as well as the quantitative data, but both are important. So that's where I would go.
All right, thank you. Another question from Anne is, there's a wellness team and they offer occasional events, challenges, and learning sessions, but some staff don't participate. How can we craft something that benefits most staff?
That's a great question, because not participating in activities, it can be really disheartening when you've planned something and you've worked hard on it and not that many people show. Um, the first thing I would do is ask the staff who don't participate what they would like to see and what would make it easier for them to participate. So it may be that some of the events are too long. So if the event is a full hour, folks may not have that. It may be that the event is held at a time that doesn't work for the staff. And there'll be some staff that just aren't interested. Or it may be the activities that are being offered aren't ones that the staff would necessarily want. Like I'm a big fan of certain types of yoga. I love restorative yoga, but not everybody's a yoga fan. Some people prefer meditation. Some people prefer social events, with food. So I think exploring with the staff what they want and finding out from the folks who aren't coming how the event can be more accessible to them would be a good start.
Thank you for that. And David has sent a comment. We just finished a work-life balance and workplace stress survey. The survey was aimed at the prevalence of both in our workforce. We have the data and now are getting ready to analyze the data. The goal is to engage employees in ways to improve both areas. Your recommendation about creating a plan is quite timely for our organization. Thanks.
That's fantastic, because you took the first step, which is finding out where you are. And that is really exciting. If I've I've done these surveys with a couple of different organizations, and if there's anything I can help you with, if you want to email me privately, I'd be happy to answer questions or, give advice if needed.
Thank you for that. Um, Another question from Stephen, how can you balance options of activities without being discriminatory?
Okay, I have to think about that. I'm not sure. So, okay, because right, because there are some people that might not be. If you have people at the workplace that can't necessarily participate in physical activities because of a disability or an inconvenience, as my mom calls it, I think it would be important to make sure you've got variety and have a variety of activities that are accessible to everyone, and that's something, or modify the activities. And the best way to do that, if it's if you're talking about having activities accessible to everyone because some folks can't participate, talk to those folks directly and find out what would work for them.
Great, so that's really just reaching out to the group and asking what the best options for
Hmm.
everyone is.
Yeah, and offering a variety of things I think is important. So, not every person would necessarily even want to participate in everything. And remember, many activities can be modified. Yoga is actually great for that. I've taken yoga classes where the people who are amazing are in some position that you have to be boneless to do. And I'm doing some very modified version of it, but we're both there.
Sure. And then, Dr. Plichta, do you have any sample wellness plans that might be available?
I don't have any sample plans. The ones I know of are proprietary, so not necessarily shareable. But I could certainly come up with a general framework for them, and then like come up and share a recommendation for. I actually have a recommendation. I have a recommended framework for a plan, but not a specific one I can share.
Okay, so that participant is encouraged to email you and reach out to us after the webinar for
Yes.
some more specific recommendations. Great. So I wanted to give just an opportunity for the audience to send us some, you know, thoughts and ideas from them. So as part of your QI performance improvement team, are there any specific projects that tend to be the most stressful, and how might the team use some of these wellness activities or knowledge to improve that project's outputs or outcomes? So if you have any ideas on this, please send them to us. And another question for you, Stacey. What is the best way to interact with a coworker who chooses to have high stress levels? Um, just mitigating that energy level.
So I guess is that a question from the group or from you?
That's from the group.
Okay. So since I'm not sure exactly what that means, if it's someone who is dumping their stress on you, it's very different than someone who is simply choosing to like live in what's maybe perceived as a higher stress life. So the responses would be different. If it's someone that you think might welcome assistance in restructuring some of their workload, since we are talking about the workplace, or work so as to reduce some of their stress, you could approach them about that. If it's someone who is, you know, sharing their stress, like coming in, this is where mindfulness can help. So instead of reacting to that person and they're coming in all tense, because if someone comes to me and I have a lot of students who, who very legitimately are upset about things, and my first reaction is always an empathetic one. I'm upset there with them, but it's not a helpful reaction. So mindfulness, that's stopping, observing, what am I feeling right now while this stressful person's in front of me? What do I think of this? And it can be very quick because we can think quickly, you know, just that little pause of what do I want to do about this? And like detaching yourself from the stress, you can fully acknowledge the other person's stress. You know, I can see you're very stressed out about this. I can see this is difficult for you. You know, how can I help if you're choosing to help, or just simply empathizing if you're choosing not to? But you don't have to be stressed because they're stressed.
Yeah, that's a good reminder. Thank
And
you.
that takes practice, by the way. Don't, if you can't get it to work the first, second, or third time, it took me a long time. Detachment comes differently to different people. It took me a very long time to be able to not immediately engage and wait and watch and listen and then react.
Yeah, even wellness takes practice. That's
Yes.
sure. So we just have a few more moments, and I wanted to encourage all of you who called in today to really think about these questions that are up on the screen right now. And when you leave this webinar, there's some really great knowledge that was shared and some activities that could serve to just at least start some thinking around how to implement these wellness activities in your projects, and whether that's at team meetings or as some boundaries or uh, expectations when you are implementing some stressful work projects. Accreditation takes a lot of resource and energy to implement. So please keep us posted on, phPIN forum, how you implement any of these. We would love to hear how that's going. And just some info, if you're not already part of our Performance Improvement Network, which is phPIN, please visit our URL at nnphi.org/phpin. You can learn more about it, send in an application to join. It's a couple different components to our community. We'd love to see you on there. And we'd also love to hear from you about your professional development, what you can share with the community, and enriched public health practice for other practitioners. Just keep in touch with us if you would be interested in presenting. And I wanted to share a special thank you to Dr. Stacey Plichta for joining us today. We learned a lot about how wellness has been affecting us in ways we may not know, and how our projects could potentially improve by thinking about these things and remembering stress boundaries and how to mitigate workplace stress. So thank you so much for being on our webinar today.
Yes, and I thank you for having me. I really enjoyed presenting the material, and I hope it was useful to folks.
Thank you, and we will post the recording and slides on phPIN and the NNPHI webinar site. So please keep a lookout for that, and email me directly if you can't find what you're looking for. All right. Everyone have a wonderful afternoon, and we will be back on the air next month in November. All right. Goodbye.
Okay. Goodbye.